Standard treatment of acute graft-versus-host disease hasn't changed in the last couple of decades, and that's driven a lot of the research that we're doing now. Zach, can you describe what your standard or our standard approach is for dosing of steroids for patients with acute graft-versus-host disease and where that is?
Sure. So for patients who don't respond to topical therapy, or for patients who have more severe involvement of their graft-versus-host disease at the time of diagnosis, the standard of care is systemic corticosteroids. Now, there's actually not much data published about the ideal starting dose for corticosteroid therapy in patients with acute graft-versus-host disease, but the majority of the data suggests that a dose more than 2 milligrams per kilogram per day probably adds no benefit. Thus, the consensus guidelines from the American Society of Transplantation and Cellular Therapies is that the starting dose for graft-versus-host disease therapy be somewhere between 1 and 2 milligrams per kilogram per day. In our practice, our starting dose depends on disease-related factors and also patient-related factors. So for patients who have more severe organ involvement that includes the lower GI tract or the liver, we often start at the higher dose of 2 milligrams per kilogram per day. But in certain cases, in older patients or in patients that have just isolated skin involvement, we may start at the lower dose of 1 milligram per kilogram per day. The question then becomes, what's the best way to taper these steroids? And that really depends, once again, a lot on how the patient is responding to therapy, but also whether the patient is experiencing toxicities from the steroids, because especially in our patient population, which is often older, we see a lot of steroid-related toxicities, which can include hyperglycemia, hypertension, insomnia, weight gain, and over time, patients can even experience adrenal insufficiency. So we typically taper our steroids about once a week with the goal that if a patient is having a good response, to get that dose of steroids down to around 0.25 milligrams per kilogram per day over around the first month of treatment. After that, the additional taper of the steroids, the timing, and the dose reductions really depends, once again, on whether the patient remains with a good response to steroids or whether they're having a flare, and also whether they've experienced any of the previously mentioned toxicities.